Hello, good morning and welcome back to The Breakfast Show. It is 5 minutes to 9 a.m. here on a glorious Monday.
Glorious indeed, especially for football fans. But of course, we'll move away from that. I think that's a little bit enough. But we'll talk about non-communicable disease, or NCDs, which account for almost 51% of deaths in Southeast Asia, and 50% of the cases are caused by
poor lifestyle habits. Now, these are pretty scary facts and about something that can be easily prevented, and of course, proper knowledge and healthier lifestyle choices. And of course, to help promote awareness on their campaign, we've invited on the show the Ministry of Health. We've got Dr. Faisal Izwan, who is the Senior Assistant Director of the NCD.
All right. Good morning, Dr.
Good morning, Aisha. Good morning, Nas.
And we wanted to find out, of course, when you talk about non-communicable disease, basically it's where Malaysians go, huh?
What?
Yeah, exactly. Sure. So do tell us what it's all about.
Sure. When we talk about non-communicable diseases, what we mean is basically cardiovascular disease, which means heart attacks and stroke. We're talking about diabetes, and we're talking about cancer.
So those are the three main diseases under NCDs.
Under NCDs in the context which we will be discussing today, this morning.
I see. So another definition of a non-communicable disease is a disease that is not contagious.
Sure. I mean, if you use that definition, then NCD
then there are
includes
a lot of other things too.
You're talking about road traffic accidents. You're talking about violence and injury. Well, in a way, there are, because they are all
manifested
by our habits, our bad habits.
Now, of course, but the focus here is actually lifestyle. Of course, it's also bad habits that cause these NCDs, but more towards lifestyle. And then let's talk about the fact that usually when we talk about heart disease, strokes, diabetes, usually we talk about first world countries, countries that overindulge, those who have obesity problems. But usually it's second or low to middle income countries usually don't have this problem. But is the trend changing?
Well, we don't need research to see how big Malaysians have become.
Apparently, we've been called the fattest Asian country.
Yeah. I mean, I'm sure you had the opportunity to travel to our neighboring countries. If you walk around, you don't have to go far. You walk around Thailand. I mean, of course, if you walk around Korea or Japan, you can see how thin they are. You walk around KL, you can see not just the adults, but even our children are getting bigger and bigger. I mean, it's quite not that uncommon to see, the father is quite big size, the mother is quite big size, and the children are also
little big size.
They're all eating the same food, probably.
And we've seen this drastic increase in obesity just over the past 10-15 years. So this is not just solely because of our genetics, because we have a predisposition. Some families do have predisposition to be obese. But it's basically the food that we eat, and also how we have become inactive, really, in our daily lives.
So we've started living sedentary lifestyle, yeah? But at the same time, when we talk about other Asian countries, like you said, South Korea and Japan, they are thin people. You've been there as well, Aisha. Yeah? The thing is, take for example the Japanese. They love their food, and 50% of all TV shows in Japan are about food. But at the same time, the awareness is there for them to of course, eat healthily as well. What do you think is lacking here in Malaysia?
Awareness, we feel, is something we can work upon. There is still, for sure. But however, the environment, sometimes there is still, for sure. But however, the environment, sometimes, we choose things that we want to do influenced by the environment that we live in. For example, just take a simple example. If you want to exercise and you live in KL, how easy it is for you to exercise. Even if you have the facility like the park, do you feel safe? I mean, you as a single lady, do you feel safe to jog even during the day?
I choose days when there are a lot of people, or I go with a jogging partner.
Or if you talk about children,
the kids don't play outside nowadays.
Yeah. I mean, not just because they don't want to,
but it's not safe.
It's not
scary.
safe. I mean, myself personally, I will not let my children play outside of my
compound,
or where I can see them. Whereas during my time, I can just
let them
disappear.
Even during our time, you know.
Yeah, you see, you know the neighbors are going to be watching over your kids, you know. But now,
unfortunately, because of all of these, what we're doing is we're actually, we're nurturing an unhealthy generation of kids. And now, unfortunately, rates of non-communicable diseases are on the constant rise here in the country. And hence, MOH now is doing this, starting off this campaign. It's an awareness campaign. Sure. Now, what are the steps that the MOH has taken to actually put the word out there?
In terms of, we want to create awareness, yes. We want people to feel that it is becoming a major problem for us in Malaysia. We want to tell Malaysians that more and more people are dying because of NCD. And the main point is that, of course, we all die of something at the end of it. But we are dying young because of NCD. Our data shows that almost over 40% of death due to NCD in government hospitals are occurring below the age of 60 for men and women. Again, you don't need research. I'm sure you know of friends, of relatives who have their first heart attack in the early 50s or early 40s. Stroke even before 60.
Yes.
I mean, just look at the number of by-elections. I mean,
unfortunately, that's quite true.
We're not talking about politics here, but you look at the number of by-elections since the last general election, and you look at the information available from the from the news, and you realize that a lot of them die because of either they have diabetes or their heart problem.
So, would you say that heart disease is actually the #1 killer here in the country?
It is, and even for what we call premature death below the 60 years, it is the most common cause of death. And if I may, one thing, the message that I want to give across this morning is how important it is for you as individuals, for yourself even, to do regular health screening.
Yes, that's the message, the ultimate message that the Ministry of Health wants to push forward. Everyone needs to be aware to go for their own self-screening. I mean, how often should one go for self-screening?
Let's put it this way. I mean, you've both got cars, I'm sure.
How often do you go send your car to service?
The point is, I just want to share with you that people take better care of their cars
than their own bodies.
No, because it's better not knowing. Probably people it's being in denial to a certain extent.
Could that be the #1 killer? Actually, denial, doctor.
I'm not going to deny that ignorance is bliss.
True.
Right, but going back to your question, we recommend you do annual health screening once a year if you are over the age of 40. But if you have what we call risk factors, like you have a strong family history of heart disease or stroke, that means either your parents or your siblings, your first-degree relatives, or if you're obese, big size, or if you already have what we call borderline or pre-hypertension,
the red flags,
or your blood sugar is on the high side, or your cholesterol is on the high side, then you ought to get your screening earlier, even from the age of 30.
Now, what are the MOH actions or efforts that are taken to spread the word to more rural areas? Unfortunately, these are not diseases that are just happen in the urban center, urban city, whereas a lot of rural areas have it. And of course, maybe in certain places don't have the access to the medical health care that we do in the city, or they're just too busy doing other things like bringing income to the family than to actually go and get a health check.
That's the thing about creating awareness. There's a role still for media campaigns, right? But even in our health clinics, this has been going on for a number of years, we have already incorporated what we call health screening anyway for individuals coming to the clinics for other complaints. So if they come for cough and flu and we've noticed they're on the big size, then we would offer them screenings. And nowadays, even if you go to the health clinics or government hospitals, in the waiting areas, you can see the places where you can measure your own weight and height, so that you can calculate your own BMI. I just noticed when I was entering the main lobby, you have the machine to self-monitor
Yes, we do. Yes, we do as well.
You can see those in shopping complexes. It's not just getting yourself screened, all right? It is also about knowing what your results
will be for the follow-up,
what is the optimum target. Sometimes, the first question is I ask when you have your last medical checkup, you will say never, something like 3 years ago or something. Even if they say they had it in the last few months, I'll ask them what was the results, and they would just typically answer, it's normal, okay lah, or the doctor say okay, and then I'll just probe. It's not like a test. You just probe. Oh, what was your BP, by the way? Because we like to monitor trends, and we like to know what the previous results were. What was the blood sugar? What was the blood cholesterol? Most of them cannot remember. I said that's fine. I can't remember a lot of things. Then should have written somewhere.
Absolutely.
And then the next question is, do you know what's normal? And a lot of people don't know what's optimum.
Yeah, so should know it. Now, of course, with regards to a lot of diseases and illnesses out there, they always say prevention is better than cure. So possibly you could give some of our viewers out there, and us, of course, because we need to know, what are some of the, tips or things that you can do on a daily, every day, in order so that you possibly can reduce the risks of getting a
TV show host, you look very, very...
There's all makeup
we
and,
We are this close to hypertension. I hope my boss is watching. You're this close to hypertension. But please tell us.
They're talking about mental stress.
Yes, it also involves getting a stroke while you're on air. Oh my goodness. Touch wood,
Alhamdulillah.
The thing is, you have to go back to basics. If as Muslim, right? The easiest example for me is your exercise, watching what you eat, and not smoking is like the benda wajib.
The 3 pillars, let's put it that way.
3 pillars, most important thing. Anything else is your sunat or optional. So even if you do the sunat, no matter how much, but you don't take care of your pillars, then you're missing the point. Missing the point. So in terms of exercise, in terms of eating well, exercise is easy. You need 30 minutes of moderate intensity kind of thing, cumulative.
A day?
A day. It's not 30 minutes one stretch. You can accumulate. And research have shown even if you can't do your 30 minutes, a bit of exercise is better than nothing.
It goes a long way,
Right? So you can sort of accumulate things. Diet, the simplest, you can talk about diet for 1 or 2 hours. But what I want to say here is to make sure that you're taking enough vegetables and fruits, at least 5 servings daily.
All right. So fruits will be
and of course, if you're a smoker, stop smoking.
That would be the number one message that, of course, all government doctors are giving out as they see patients. Now, of course, if you do want to know what your cholesterol level, or you want to watch your cholesterol levels, you want to watch your sugar levels, you won't know until you go for that medical checkup. So
exactly, go for it.
We'd like to encourage you on the Breakfast Show. Go that. If you've never done it before, go for your very first one. At least you have a benchmark of where to move on after that. And thank you so much to the Ministry of Health for your initiative. Of course, it's about eating right. It's about exercising. Get off that couch and start moving your muscles. And last but not least, if you have bad habits, alcohol, smoking, cut down, put it all together. All right?
Exactly. Thank you very much, Dr. Faisal. Okay, it's time for us to take a quick break, but coming back.